Stroke is the leading cause of serious disability in this country and the third leading cause of death. But student Tramilla Johnson never thought she would be a statistic.
I knew the class was about to be over, so I checked my phone and I laid my head down and immediately I couldn't move and I knew I was in trouble.
In the U.S., over 800,000 people have strokes each year still. And a really sobering number is that every 40 seconds somebody in the U.S. is having a stroke.
There are two major types of stroke. One is hemorrhagic, where a blood vessel bursts in the brain. But by far the most common is ischemic, where a clot blocks blood flow to the brain. What's most important with any stroke is getting the patient the right treatment in time.
Where there's a major artery blocked, over 2 million neurons die per minute. Once that tissue is damaged, it's irreversible. When they can ordinarily walk, take care of their own affairs, dress themselves, feed themselves, all of a sudden that stroke leaves them devastated.
Dr. May Noor is director of UCLA's revolutionary new mobile stroke unit, cutting precious minutes off the time it takes to get patients help. It is staffed with a doctor, paramedics, clinical nurse, telecommunication to stroke specialists at the hospital, a mobile lab, and CT scan to make the most accurate diagnosis.
We're really trying to revolutionize stroke systems of care, meaning that instead of waiting for the patient to come to the hospital, we actually bring the hospital to the patient.
On scene, doctors can give medication immediately to stop the bleeding or dissolve a clot. At the hospital, larger clots can be removed with a tiny non-invasive catheter.
Grab the clot.
Guided through an artery directly into the brain to pluck the blockage out.
It can make a difference between a father spending the rest of his days with his family and walking his daughter down the aisle versus spending the rest of his life in a nursing home.
And we need to recognize symptoms of stroke. Experts use the acronym FAST. Look for face drooping, arm weakness, speech difficulty, and T, time to call 911.
I couldn't feel my body, I couldn't move. So I'm glad that people were there. And I was right across the street from the hospital, and that's what saved my life.